What part of the medical history should they focus on? What are red flag symptoms indicating dangerous associated disease to look out for?
Well, I tend to focus on the severity of their physical and even mental limitations and their patterns of symptoms. Is there a component of anxiety or depression that may be impacting all of their symptoms as well? So you have to think about that. But really noting what they could physically do before and after COVID and what has the trajectory of symptoms been would be important. I also want to know about their underlying medical issues and how severe their COVID infection was, but really asking about cardiac and pulmonary symptoms such as palpitations, syncope, severe dyspnea, or sleep disturbances, I think would be important. If they have acute chest pain or progressive symptoms and acute episodes of shortness of breath, I think those are definitely red flags that need further investigation.
And what would they be looking for or bearing in mind with those red flags?
So I think focusing on cardiac and pulmonary exam, is there an abnormality to the pulmonary exam that may suggest they have interstitial lung disease? Are they having, acute shortness of breath and chest pain that you might think about a pulmonary embolism or an acute pneumothorax? If they have progressive symptoms despite simple symptom management, those could be red flags that there may be another condition that they need to be looking for.
Okay, could you give an example of one of those?
So cardiomyopathy, maybe heart failure, myocarditis, and again, like I mentioned, pulmonary embolism. So your leg swelling or sudden acute shortness of breath or chest pain that is pleuritic in nature may suggest pulmonary embolism. So certain things that you're going to have to act on more acutely. They could also have acute cardiac dysfunction like an MI. Otherwise, unilateral findings on a physical exam might suggest you need to do more imaging and take things a little bit on a quicker pace.
Great. And for our non-medical audience, the myocarditis is an inflammation of the heart muscle. Pulmonary embolism is a clot in the lung, both of which can cause death in certain scenarios, and a myocardial infarction is a heart attack.